Good morning to everyone that is connecting to this launch event from the Americas. Good afternoon to those of you who are in Africa, in Europe. Good evening for all our colleagues and friends in India, in Pakistan, in Southeast Asia. Good night to our friends in Japan, in Australia, in New Zealand. We know that you are making a big effort to stay awake in the case of you that is late in the night to attend this seminar. So welcome everyone and thank you very much for being here. My name is Orlando Flores and I am from Chile. I work for COANICEM in Chile and I represent the Latin American Burn Federation in the World Burns Week Steering Committee. It is a pleasure to welcome you all and help you to navigate through this remarkable event. World Burns Week is a collective effort. It is the result of collaboration among many entities devoted to improving the lives of burn survivors worldwide. World Burns Week is a novel initiative that brings together different stakeholders along the continuum of burn prevention, care, and survivorship to promote better understanding and partnership and to bring attention to burn injuries as a global health issue. We started the idea of celebrating World Burns Week during the last months of 2023, and a year later, here we are, giving this initiative the impulse it needs to succeed. We are very, very proud to say that no other initiative before has brought together such a diverse group of people and organizations in burn care to give the phenomenon of burn injuries the attention it deserves. Thank you very much to all of you for joining us today. The World Burns Week is being organized by a steering committee representing burn injury entities across the globe. I would like to start this launch event by addressing those organizations and their leaders, all of them present at this event. First, I would like to address the burn injury entities that are participating in the organization of World Burns Week. So I could start by greeting the International Society for Burn Injuries and its president, Professor David Harrington. The ISBI is represented by Michael Sergio in the steering committee. Thank you very much, David and Michael, for joining us today. The Asia Pacific Burn Association is represented in the steering committee of World Burns Week by its president, Professor Vinita Puri. Welcome, Vinita. Thank you for being here. We also welcome the Pan-African Burn Society, and the representative in the steering committee is Dr. Mansour Fall. A warm welcome as well to my federation, the Federación Latinoamericana de Quemaduras, FELAC, and its president, Dr. Bruno Valmelli. I think that Bruno is also connected here. Well, I'm the representative of FELAC in the steering committee. We also greet the Euro-Mediterranean Council of Burns and Fire Disaster and its president, Professor Bishara Tillet. The representative of MBC in our committee is Dr. Ronan Leflot. Ronan, I think is there with us. We also welcome the European Burn Association and its president, Professor Stian Almeland. Hi, Stian, how are you? The representative of the EBA in our steering committee is Professor Mamta Shah. Hi, Mamta. We also welcome the American Burn Association and its president, Dr. Sharmila Dissanayake, that is represented in the steering committee by Lucy Rogan. We also have with us the Australian and New Zealand Burn Association, ANSVA, and its president, Dr. Francois Stabelberg. The World Burns Week Steering Committee representative from ANSVA is Siobhan Connolly. Hi, Siobhan. And Interburns from the UK is represented by its CEO, Tina Bajek, and Lucy Kinch, who represent Interburns in our committee as well. The Phoenix Society for Burn Survivors from USA is represented by the president of the board of directors, Mr. Jeff Gallinat, and by Amy Acton, who represents Phoenix at the steering committee. Hi, Amy, how are you? Finally, we also would like to address the G4 Alliance that has played a crucial role in supporting all the work behind the World Burns Week organization. So we also want to welcome Mrs. Natalie Shainman, Mrs. Leslie Long, and Dr. David Schiffers as well. We also have a very extensive list of endorsing partners. We are very, very happy to have more than 30 different organizations that are also supporting World Burns Week, and we are going to make a quick read. We cannot have enough time to share the name of all the presidents of the organization, but please, every one of you that belong to one of those organizations, please be very welcome. The Ever Burn Foundation, the Italian Society of Burns, la Sociedad Chilena de Quemaduras, la Asociación Mexicana de Quemaduras, the National Fallen Firefighters Foundation, la Asociación Dominicana de Quemaduras, the Belgian Burn Foundation, la Clínica Nuestra Señora de Fátima en México, la Corporación de Ayuda al Niño Quemado, COANIQUEM, de Chile, la Asociación de Ayuda al Niño Quemado, ANIQUEM, de Perú, the Society of Plastic Surgeons of Bangladesh, la Asociación Argentina de Quemaduras, the National Academy of Burns of India, la Fundación Michu y Mao de México, el Hospital General de Chihuahua, Dr. Salvador Subirán Anchondo, IMSS UMAE 71. I'm not sure which country is this association from. La Clínica Hospital Mérida de México, the Society of Plastic Surgeons of Bangladesh, the Burn Healing Foundation, the Japanese Society for Burn Injuries, our friends from the Sunshine Social Welfare Foundation in Taiwan, the Burn and Trauma Association, the Korean Burn Society, the Al-Masr Foundation from Egypt, the Association of Burn Centers in Germany, the Taiwan Society for Burn Injuries and Wound Healing, the Prince Medical, the International Women and Children Burns Foundation, Global Surgery from Amsterdam in the Netherlands, the Association of Plastic Surgeons of India, Derma Roller, Monique Healthcare, Global Surgery Umbrella, Research International, Atijivan Foundation from India, British Burn Association, the East Avenue Medical Center, the Leo District Council in Nepal, the Pratap Hospital, the Bemde Hospital for Plastic Cosmetic Burns and Hand Surgery in India, the Department of Plastic Surgery and Burns in India as well, Physicians for Peace, la Asociación Mexicana para la Prevención y Tratamiento de Quemaduras San Martín de Porres, Beyond Burns International, OSCARE in Belgium, the Burns and Plastic Surgery Center in Pakistan y la Asociación Sobreviviendo a Quemaduras del Hospital Nacional de Niños de Costa Rica. As you see, there's an extensive list of supporting partners that we welcome today in this launch event. Once again, thank you, all of you, for supporting World Burns Week this year and for starting this launch event. I would like to invite you to watch the following video. Please, the video requires you to mute your own phone and to put your volume as up as you can. Thank you.
I'm Vinita Puri, and I'm president of the Asia Pacific Burn Association. The APBA is honored to be a part of World Burns Week, which is to be celebrated from 4th November to 10th November. The Asia Pacific Burn Association is dedicated towards burn care in this whole region, which also includes some of those countries which have the largest burn burden in the world. With collaboration and educational initiatives, the Asia Pacific Burn Association works towards empowerment of the first responders of burn care, as well as improving the burn knowledge of those who can provide advanced burn care. I hope that many organizations in our region and across the world share the vision of the World Burns Week to help reduce the burn burden across the world. I look forward to everyone joining the virtual programs of the World Burns Week between 4th November and 10th November, and also contributing in their own way towards World Burns Week. Thank you and bye-bye.
En nuestros países hay un número importante de pacientes quemados que van en aumento. Sobre todo son niños que se queman en el hogar. Todas las quemaduras son eventos totalmente prevenibles. Es sumamente interesante esta primera Semana Mundial de Prevención de Quemaduras y debemos darle el valor que merita. Desde Ibero Latinoamérica nos comprometemos a dar el mayor de nuestros esfuerzos para que esta Semana Mundial de Prevención de Quemaduras sea un éxito total.
Hello, I'm Dr. Shamala Disnaga, President of the American Burn Association. At the ABA, we are honored to join World Burns Week with 10 other partner organizations to be celebrated November 4th through the 10th. The ABA is dedicated to improving the lives of everyone affected by burn injury. We have over 2,800 members worldwide, and these include firefighters, nurses, therapists, and physicians. Together, we're working to advance research, burn care, quality, and prevention. World Burns Week is a vital effort in this endeavor. Burns are a global health challenge, and it especially affects people in low and middle income countries. We are excited to support this initiative and work toward the vision of a world where burn care, state-of-the-art burn care, is accessible to everyone. The ABA is committed to raising awareness and promoting equity in burn care. Please be sure to check out the World Burn Week webinar series, which will kick off this November. Our members are actively participating in this initiative by sharing knowledge and resources to make a real impact on burn prevention worldwide, as well as quality burn care and support for survivors. Thank you very much for supporting this important cause. Together, we can create a brighter future for everyone affected by burns.
Hi, I'm Tina Bites, CEO of Interburns, the International Network for Training, Education, and Research in Burns. It is an honor to speak to you as a member of the steering committee for the first World Burns Week, which will be held between the 4th and the 8th of November. Since 2006, Interburns has dedicated itself to working with and for healthcare workers, nurses, surgeons, therapists, nutritionists, and psychologists. From low resource and complex settings, we aim to improve the quality of burn care and prevention and help to build sustainable burn services. Burns are complex, very complex, one could say, and perhaps this is a reason why they're consistently overlooked and continue to be a major global public health crisis, a hidden one, I would say. They're overlooked by governments, by organizations, and of course by funders. Burns affect the individual, patient, healthcare worker, and survival, but also they affect families, futures, their finances, and they profoundly affect the health system and services as well. Burns are very unique, but huge advances have been made in high-income settings, and we believe that it is possible and necessary to make sure that happens around the world through partnerships, commitments, advocacy, and advance-based initiatives. It is vital for us to focus on low-resource settings, where the need is the greatest and the biggest imbalance, and it's important to improve the quality of prevention, care, and survivorship. we at Interburns wholeheartedly support World Burns Week this November and urge everyone to get involved, whether that's at a local, international, national level. Just participate. No action is too small. Put up a poster, organize a run, lobby for change. Just get involved to help shine a light on this hidden crisis. Thank you.
Dear all, I'm Stian Almond, President of the European Burns Association. I'm honored to stand with you during World Burns Week. Burns affect millions globally every year, yet many still face barriers to life-saving care due to limited resources and awareness. We in the European Burns Association believe that everyone, no matter who you are and where you are, should experience well-placed burn prevention and have access to timely treatment and rehabilitation. World Burns Week reminds us to unite as a global community. Together with patients, advocacy groups, and organizations, we can raise awareness and collaboration and ensure that every survivor gets the care they need to recover and thrive. Thank you.
Hi, I'm Jeff Gallinet. I'm a burn survivor of over 45 years, and I'm currently serving as the board president of the Phoenix Society for Burn Survivors. Our nonprofit has been providing programs and services for those who've been living with burn injuries now for nearly 50 years. So we've served thousands of burn survivors and those who care for them, and we know the many, many stories about the deep impacts of burn trauma. The social stigma, emotional trauma, and lost engagement in work, school, and society are all truly significant issues that we need to take away from the shadows. And we all need to work together to elevate the understanding of these impacts globally. We also know very well that with increased investments in quality burn care, physical and emotional rehabilitation, and community support, many, many more burn survivors can and will thrive. So we in the Phoenix Society are very honored to join the 10 other organizations launching the inaugural World Burn Week this November 4th through 10th, and we enthusiastically will invite others to join this effort. So let's all go and join together to increase awareness of both the injury crisis and then also to highlight the need for investment in prevention strategies and quality care for everyone who's impacted, regardless of where they live, and especially for those in countries where the need is the greatest. Together, we can all help to build a safer world and one where burn survivors not only heal, but they thrive. Thanks very much.
Et merci de participer à cette réunion de lancement de World Burn Week. Je parle au nom du MBC qui a été créé il y a plus de 30 ans maintenant, avec des personnes de pays favorisés et moins favorisés, dans le but de partager les connaissances sur la brûlologie. Il développe régulièrement des cours spéciaux sur la demande de personnes souvent des pays moins favorisés pour développer ce qui peut se faire dans les pays favorisés et en échangeant avec eux, voir comment eux ils peuvent adapter ces préconisations de telle manière à diminuer les différences de prise en charge entre les pays riches et les pays pauvres. Raison pour laquelle le World Burn Week est extrêmement important du point de vue du MBC. Et le MBC continuera ses actions dans ce sens. Merci.
I'm Dr. Francois Stapelberg, President of the Australian and New Zealand Burn Association. As burn clinicians, we are well aware of the risks that burn injuries pose to our patients, their families and their communities. We're also aware of the risks burn disasters pose, both natural and geopolitical conflict. Within Australia and New Zealand, we focus a lot of effort on burn prevention programs, including cooling the burn and trying to reach our vulnerable populations, including Aboriginal, Maori and immigrant communities. We also focus a lot of effort on burn education in terms of caring for the patient who's had a burn injury. One example of this is our emergency management of severe burns program that's presented not only in Australia and New Zealand, but the neighbouring Pacific countries, as well as under license in several countries in Europe. During this World Burn Week, we'd like to lend our support to all the burn societies around the world try and lift the veil on the risks that the hidden burn epidemic poses to all of our patients and our communities. Greetings. Thank you from the Australian-New Zealand Burn Association.
Hello, I'm David Harrington. I'm a burn surgeon from the United States and the current president of the International Society for Burn Injury. We are excited about World Burn Week and the recognition and attention that this week will bring to our cause. The existence of this week shows what partnership and advocacy can do and can accomplish, and we want to thank all the societies and institutions that have lent a hand to make this week possible. And keeping with the ISBI mission to improve burn care throughout the world, we are launching a program in 2025 to visit burn centers in low and middle resource countries throughout the world to see if we can help provide a pathway for improvement of burn care in their burn centers and in their communities. We hope that this advocacy will improve burn care throughout the world. Using this week as a stepping stone, let's improve the outcomes for burn injuries throughout the world together.
Hello, my name is Claudio Tanca, and I am the Executive Director of the Global Alliance for Surgical, Obstetric, Trauma, and Anesthesia Care. Around the world, it is estimated that 2/3 of people lack access to emergency and essential surgical and anesthesia care when needed. These disparities are most significant in low and middle-income countries, where 9 out of 10 people cannot reach or afford quality and timely care. These inequities are reflected in the burden of burns, with disproportionate injury and disability affecting people in the poorest country, in large part due to inaccessible or under-resourced system for surgical care. The 2024 theme of the World Burns Week highlights a critical message. Burn injuries are a global health crisis that needs the world's attention, and burn patients and survivors represent some of the most neglected surgical patients. We need to work together toward global equity to generate better data, increase political prioritization, and ensure that robust resources are allocated to the full spectrum of care, from prevention to treatment, rehabilitation, and survivorship. That is why I am proud that the G4 Alliance is a supporting partner of the first ever World Burns Week. Thank you for joining us today.
Thank you very much for all those inspired messages from leaders in burn care around the world. And this is very important to have all of these people coming together to support the first ever World Burns Week. And I would like to invite you now to know a little bit more about the week and what it represents, what are their objectives. And for doing so, I would like to invite Professor Mamta Shah. Mamta is the EBA's representative in the World Burns Week Steering Committee, and she will be sharing with us the main goals of the week we are going to celebrate next month. Mamta.
Thanks very much. Hello, everybody. And it's an honor to be able to join the global community. Just to give you a background, not that you haven't just heard from all the inspiring speakers, just to give you a little bit about the background, that burn injury is a significant global health challenge. In case you had forgotten, I'm reiterating that again. So millions of new cases are reported annually. However, there are lots more that go unrecorded. And I think it is an important aspect of the World Burns Week to make sure that everybody is captured and everyone is made aware of this problem. Unfortunately, there's a disproportionate burden on the low and middle income countries. And this is why the World Burn Week is very important in ensuring, next slide, please, in ensuring that we raise the awareness, we facilitate greater collaboration. As you have just seen, the entire world organizations have participated in this and work collectively towards global equity in the burden and care continuum of burn injuries. By convening stakeholders, promoting the understanding, and advocating change, we strive to make a tangible difference to the lives of those affected by burns worldwide. And you have already heard that when a patient gets injured, it's not just the patient, but the entire community around that patient that is very important and is affected by that injury. So it is a widespread problem. Our vision is a world where burns are prevented and access to timely and effective care is equitable regardless of the location, income, gender, age, or ability. And our mission is to raise awareness about the burns as a global health priority. We advocate for equity in burn prevention, care, and survivorship, promote international collaboration to reduce the burden of burns in low and middle income settings. And I think we have all heard today how important it is to make everyone aware that burns is a hidden health problem, and we should be shouting about together and collectively for making it a priority. Thank you very much.
Thank you very much, Mamta, for sharing that ideas with us. And this brings us to the main presentations of this launch event. The annual theme of this year's World Burns Week is Burns, Tackling the Hidden Global Health Crisis. So why is it important to unravel this global public health issue? How does the lack of understanding of burns as a public health crisis affect the health outcomes of burn survivors across the globe? Can we start changing the unequally distributed burden of burns by making collaborative efforts? Of course, these are questions that do not have a simple answer. However, we have invited two speakers to help us understand why collaboration through initiatives such as World Burns Week might be pivotal in changing the landscape of burn care and prevention globally. First, I would like to introduce you Mrs. Pragya Prasum from India. Pragya is an acid attack survivor and an activist who has been fighting to provide relief and rehabilitation to her fellow acid attack survivors in India. Pragya coordinates with doctors to give medical advice and personal counseling. She also works to generate a permanent source of regular income for all the survivors who are in need. Pragya is the founder of the ATGVM Foundation, and her main priority is to work for rehabilitation for the victims. She has been coordinating closely with other NGOs to rope in all the survivors and fight collectively. Pragya, thank you very much for being here. Please.
Good morning, everyone. Good afternoon to all those who are, and good evening to people in Asia and India. It is indeed a privilege for me to be part of the event and talk about myself as well as the work what we do at Atijivan Foundation. Share my screen. First of all, thank you for to all the organizers who have arranged this World Burns Week. It is so crucial and so important. Recognizing burns as a public health issue, and it also gives the burn survivors a kind of recognition that their pain and whatever they have gone through is recognized by everyone. Well, I am Pragya, and I suffered an acid attack in 2006. I was 23 years old at that time and just completed my post-graduation, and I was about to start my career in apparel management, and I just got married when and it was only 12 days of my wedding when I was acid attacked by a jilted man who wanted to marry me. And, because I got married to somebody else, he threw acid on me. Well, acid attack has always been associated with not merely the physical assaults, but it is an attempt to erase a person's identity and existence. And this is the uh, thought behind what perpetrators do. Uh, when they threw acid on somebody. Um, I lost vision in one of my eye. I lost an ear. I lost my old identity, and it took 3 years to me to come out of that trauma. It was not only me, but also my family who suffered during my surgeries and during those times. Um, you know, it will be least to say that what my family and how they have supported, and only because of them I am able to stand today and talk uh, about myself, as well as support so many thousands of survivors across the country. um, After I healed and I bounce back in my life, I wanted to do something for the burn patient. And I had made so many burn survivors as as my friends, and I all I was in touch with them, but I used to guide them that you go to this hospital for surgery and to this doctor for this reconstructive surgery, because for during my treatment, I was fortunate enough that my parents could afford uh, a reconstructive surgery at one of the best hospital in our country. But I could see that there are so many patients who come from underprivileged background whose parents couldn't afford quality surgeries. And whenever I used to guide them, the only question which used to come back to me was, who will afford, how will we afford those expensive surgeries? And that's why I started Atijivan Foundation in 2013 to provide reconstructive surgeries to those patients free of cost. Since then, we have been able to restore many, many lives, not only through reconstructive surgeries, but other non surgical treatment, and also through skill and vocation training for these patients. During my uh, course of treatment, I was always scared to go out and talk to people. Even my old friends were not able to recognize me. There was an instant when I was at the airport and I saw one of my old friend and I waved at him and he couldn't recognize me. And that was the time when I realized that I have lost my identity. Every time when I was in the mall or on the roads, there were people asking me, what happened to you? And sometimes it was overwhelming for me to answer all those questions to each stranger who were asking me those questions. And it was overwhelming for not only me, but for all my family members who were walking beside me and walking in the mall or on the road or at any office. There were questions around me. There were kids who used to get scared seeing me. And, there were kids who used to shout, Mama, see, ghost. These words are very least to say that, the kind of questions and the kind of words I have heard in last 18 years. But I also understand that it could be more overwhelming to other patients who are living in rural areas where people are not even educated and people don't know how burn can disfigure someone or make them disabled. I am so fortunate to help those patients and bring them to the mainstream through a Jeevan Foundation. I call it an epidemic. Burn is an epidemic. It is definitely preventable in most of the cases. In India, we have almost 700,000 people suffering burn injuries every year. And, almost 500,000 of those need hospitalization. I myself was initially admitted in the biggest burn ward in our country, and I saw patients uh, coming inside the ward in so much pain. Seeing most of them going out shrouded in white cloth was so hurtful for me. I'm so thankful for the World Burns Week. I always wanted to have something like this so that I can talk to, my friends, my colleagues, and other people about how burn can affect someone's life. World Burns Week is very crucial for the awareness of burn patients and recognizing the survivors of their determination and their fight. It is very important to build a world where burn survivors are not only seen as victims, but as warriors who have fought extraordinary battles. This week doesn't only serves as a powerful reminder that burn injuries are preventable, but that also right actions and can save lives, and that burn survivors deserve our respect and compassion. I think together we can help them heal, grow, and thrive in their life. My idea of burn week would be that when we recognize all the burn patients, we help break stigma and promote inclusivity. We remind all of them, we remind the world, everyone around us, that burn is preventable, and through the right awareness and awareness, we can prevent burn, and we can also help burn patients to bounce back in their life. What we can do, I think we can do so much during burn week. We can commit to ourselves. I will commit to myself that I will, all these 7 days, I'm going to do burn awareness around my area, around corporates, around institutions, educational institutions, everywhere. We do nukkad nataks, we do a lot of awareness campaigns, uh, uh, around, across the country. I commit to myself that these 7 days, I'm going to do more than 7 awareness campaigns in different cities, in different setups with different kind of people, so that I am able to reach out to more and more people to tell them how burn can affect and destroy somebody's life. During this week, we can also connect to other patients and doctor and be a bridge between the patient and doctors and help them uh, get the best quality treatment in burns. We can also share resources. I think there are individuals I had asked, reach out to them to ask what splint you are using, what kind of, uh, 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 things you are using for nose contractures and, nostrils. And, there are so many things. We can reach out and share our resources. We can definitely create awareness and prevention on first aid on burns. And we can also do surgical camps to, provide free of cost surgeries, or at a, low cost to the patients who are not able to afford. Well, Atijeevan, I would like to, uh, brief you about Atijeevan. Atijeevan means survival in English, and it is derived from a Sanskrit word, and uh, we have been able to touch lives of more than 1,000 burn patients. It is not only uh, about reconstructive surgeries. We also provide, free of cost, other silicone gel sheets, scar gel, and pressure garments, which is very, very crucial and important for the uh, healing and of for the burn patients. We also provide skill training and vocational training to people who want to go back and do something, earn a livelihood. We also provide them placements in industries. So far, we have been able to provide employment to more than 60 burn patients in our network. They are working in MNCs, they are working in hospitality sector, they are working in IT sector, and I'm so proud of all of them. Uh, I think burn patient not only need counseling, they also need holistic support throughout their life, because in every phase of their life, they face different kind of challenges. During the initial phase, it would be their scars and the contractures and the surgeries, but later, uh, throughout their life, they feel that loss of identity crisis, and for which time to time they need support from the community, uh, who where they belong, and who understands them better. And that's how we always conduct burn support group meetings, so that we are able to share information and knowledge of what and how one has recovered, and how one can support each other. So it's kind of sisterhood and brotherhood for each one of us, and that's how we are able to support our burns community. I would also like to share some stories which are very, very close to my heart. These are stories of survival and thriving, how they have come out um, of and living a life with dignity and self-worth. She is Deepmala. The first picture is how I got in touch with her, and this was how she used to look in 2014. The below picture is how she looks today. She has undergone multiple surgeries in last 10 years. I would say more than 40 surgeries, especially for her eye. Today, she has 30% of vision in one of her eye, and we provided her vocational training. Today, she is working as a primary school teacher and supporting her family of parents and herself. I'm so proud of her. She is Gulnaz. She was 18 when she was acid attacked in 2015. I got in touch with her in 2016. Since then, um, uh, I we facilitated 6 reconstructive surgery for her. We also got her admitted for a graduate course in an university, and today she is working with a renowned media company, and she is married today, and she gave birth to a baby boy 3 months back. She is Archana. She lost vision in one of her eye, and I met her in 2010. She was acid attacked in 2008. We provided her multiple surgeries. We provided her training at Atijeevan, and she's successfully running a paper bag business from her home with her husband. And she also is doing a job in ESI hospital. We also assisted her wedding, and the below picture right side is how she looked during her wedding in 2014. So we train the survivors to do camouflage makeup so that, you know, everyone wants to look beautiful when they go out or they want to they want to attend any event. And our goal is to make every burn survivor look beautiful and confident when they go out and meet people. I would like to share a lot of stories, but you know, I don't have that much of time. There are girls, we have facilitated their wedding, we have facilitated their education, we have facilitated their small businesses, education, and they are, we are just, I would say it's just the beginning. We want to reach out to every burn patient and rehabilitate each one of them. These are some of the images from corporates and events where we give them a chance to speak. We give them a chance to walk the ramp. We give them a chance to train other survivors in doing camouflage makeup. We also we also do campaigns for skin donation so that we get a lot of, we encourage people in corporates and educational institutions to pledge to donate their skin so that we can save more and more burn patients. These are the beautiful pictures of, girls and boys working in their companies. One picture of a photo shoot of these mommies with their daughters and other sessions. These are the pictures of our stalls, our exhibition, and meeting celebrity, going to wedding together in group and supporting each other. Below are the pictures of street play, which we conduct at different locations. We train the students, schools and college students with plays and to create awareness about burns and skin donation, first aid, and we ask them to, do it on different occasions. We also do it at this Nukkad Natak. We have done it at President of India's, ground as well this year. Well, thank you so much for listening to me, and thank you so much for doing this World Burns Week.
Well, thank you very much, Pragya. I think that it is obvious that we fall short if we thank you for your presentation. On behalf of the steering committee, and probably I can say on behalf of all the people who is attending this lunch event, thank you for inspiring us. Thank you for the hard work you are doing. Thank you for your experiences, for turning that pain into something much better. And we will try to make of this World Burns Week something relevant for you to be proud of us as well. Thank you very much. It is a bit hard to continue, but we have a couple of things more to share with you. So I would like to introduce now our second speaker. He is Professor Tom Potokar from the UK. Tom is the chief surgeon in the International Committee of the Red Cross. Previously, he was professor of global burn injury at the Center of Global Burn Injury Policy and Research at Swansea University at the UK, and honorary consultant at the Welsh Center for Burn and Plastic Surgery. Tom has worked in the international field since 1990 with Médecins Sans Frontières in Cambodia, Bosnia, Tajikistan, Rwanda. He was the co-chair of the WHO Emergency medical team's technical working group in burns. He led the development of Interburns comprehensive integrated approach to quality improvement in burn care and has led programs in Nepal, in India, Bangladesh, Pakistan, Uganda, Ghana, Malawi, Ethiopia, Tanzania, and the West Bank. And he's a person that we all know very well. So, Tom, thank you very much for helping us to ignite this World Burns Week.
Thank you very much, Orlando, and thank you for inviting me to this really, really important event. And I think it was great to hear the last speaker, Pragya, and so important to start with the patient, because, you know, or the survivor, with those that actually suffered from burn injuries, because this is what we're all trying to do to improve the lives of people who have suffered a burn injury. So I really appreciate the fact that you've put the survivor first. I'd just really like to give a bit of a brief overview about a few things, starting with a few facts and figures. So, you know, who gets burnt, where are they getting burnt, how are they getting burnt, and why are they getting burnt, to start off with. So anybody can get burnt, you know, anybody. It can be an old person, a young person, a rich person, a poor person, a man, a woman, a European, an Asian, an African, a Buddhist, a Hindu, a Muslim. Anybody can get a burn injury. The common theme across anybody who gets burnt is suffering. And all burns, as all of us will have had some burn from touching a hot kettle or something else, we know how painful even just a very small burn is. However, we also know that burns really, in every country around the world, tend to be a disease of poverty, let's say, and it is the most disaffected usually who suffer from burn injuries, whether that's in a rich country or a poor country. Children are also disproportionately affected and suffer a huge burden of burn injuries globally. And as has already been mentioned, there's a disproportionate number of burn injuries in resource poor environments. And in some countries, it's one of the only traumas that is commoner in females than in males. So where do people get burnt? Well, you know, country-wise, as I say, it tends to be in the poorer areas of countries, whether that's in built-up, overcrowded city areas or in rural areas. And it can be anywhere. It can be inside. It can be, you know, a domestic burn. It can be outside. It can be work-related. So burns can happen pretty much anywhere. How do they happen? What causes these burns? Well, there's a huge burden of disease, particularly with children, that are caused by hot liquids, by scald injuries, which, you know, have a very significant impact. There's, of course, burns caused by flames, burns caused by chemicals, as we heard Pragya explaining from her personal experience, and something that's particularly in emerging economies as well as electrical burns. And we know that high voltage electrical burn injuries can be extremely devastating, and these are a real menace, particularly, as I say, in some of the emerging economies. Why do people get burnt? Well, we've heard already about the lack of awareness, people not understanding around the risks involved, around a lack of legislation. So the countries where burn injuries are now seen much, much less frequently are countries where legislation has been put in place, legislation around buildings, around the restrictions of what can be, the materials that can be used, the mechanisms to deal with fires if they occur, etc. The lack of power is one of the big reasons. When people don't have a regular, safe power supply, they tend to use insecure means of heating, for warming, for cooking, etc. And of course, I think particularly at this moment in history, we mustn't forget conflict either. I've been working quite a lot in the Middle East recently, and there are huge numbers of burn injuries as a direct result of some of the conflicts that are going on at the moment. So what about the consequences? What are the consequences of these burn injuries? Well, we've already heard some of them, but I think there are clearly the physical consequences. And this can be anything from a well-healed superficial burn that just leaves a minor color discrepancy, to extensive scarring with really debilitating contractures. So there's an extremely broad possibility in the physical outcomes from a burn injury. There's, of course, psychological impact. And interestingly, the research shows that this is not necessarily related to the extent of scarring. So, you know, the burn injury itself has an impact, and everybody reacts differently, and it has a different psychological impact depending on all sorts of things. But as we heard from the previous speaker, you know, this can be extremely significant. There's an economic impact. There's an economic impact for the patient themselves, for their family, but also for the economy of the country. People can lose their ability to work, to earn money. And then, of course, in many countries, most countries, hospital costs and the treatment costs are not free. So people have to pay for their care, for their treatment, and this can render them already impoverished often into sort of catastrophic poverty. There's an educational impact, particularly on children who, if they have repeated hospital episodes, you know, miss out on a lot of schooling. They may also not go to school for other reasons because they feel that it's difficult, because they feel that people will be looking at them, etc. So there's lots of reasons, not just because they have to have treatment, but why people will have it will have an impact on their education. And then, of course, the social impact in certain places, the stigma that's associated, and again, we heard before around the importance of really trying to address this and making people aware, supporting survivors with reintegrating back into society. But we also know on a practical level that there is still a lot of stigma associated with burn injuries. So how, as a global burn community, how can we reduce the impact? Well, what do we mean by reducing the impact? Really, that's two things. That's reducing the number of burn injuries that occur, and then reducing the number of deaths as well, obviously, and then improving the outcomes for those that do suffer a burn injury. And those outcomes, I'm talking about the holistic outcomes. So all those things I just mentioned, physical, psychological, educational, economic, etc. We need to improve those end results of a burn injury. So we've heard already that burn injuries are a large part preventable, not always, unfortunately, but there are certainly a significant amount that are preventable. So we do need to look at effective strategies to reduce the incidence of burn injuries. And this often does involve lobbying at a higher level for changes in legislation, etc., for increasing the education about burn care, but also for reducing the direct impact through appropriate first aid and initial pre-hospital care and initial management in hospital, which can prevent a burn becoming deeper, which can prevent some of the initial impact. And then, of course, the treatments that carry through for a long time until the patient is fully reintegrated back into society. We're looking at a holistic approach there to reduce the complications and to reduce the risk of physical contractures and scarring, but also all the other impacts that burns have. Research is also important in this area, and clearly we need to look at what the priorities are there and what the focus should be on. You know, it's one of the diseases, let's say, that has the most discrepancy across the world in terms of outcomes. And, you know, this is not accepted in a lot of other diseases, but somehow it is in burns at the moment, and we need to address that. We know how to treat burns, in fact, and get very good results in the majority of times. It's around how we disseminate and implement that knowledge and that understanding where it is most needed. And then the treatment itself is, you know, it has to be timely, it has to be effective, it has to be delivered by well-trained staff who have the right resources, and it needs to be accessible to all who needs it. So these are all things that we need to work on if we're going to reduce both the incidence and the impact of burns. And that requires partnerships, working together, and really bringing this issue of burn care to the attention of the world as a priority issue. And having spent over 30 years working in this field, you know, we are definitely going in the right direction. this is this World Burn Week, I think, is a really fantastic culmination of a lot of work that's gone on over many years to really increase the awareness to both the general public and professionals around the world about the importance of dealing with burn injuries effectively. I think it's been far too long ignored, and unfortunately burns have fallen through the gaps, let's say, over the years for many reasons. A lot of children get burn injuries, but it's not considered a specific childhood disease. It's not considered child or maternal health, even though a lot of burns happen to women of childbearing age. A lot of burn patients will die from the complications of infection and sepsis, but it's not considered an infectious disease. So it tends to fall through a lot of the gaps. And sometimes people don't even consider it as trauma. We often hear burns and trauma. Well, if burns isn't a trauma, I don't know what is. So I think it's really important that we continue with this. That this launch for Burns Week, I think, is going to really help with this. So I'd like to just finish by reciting a very short few lines from Gabriel Mistral, who was a Chilean poet who won the Nobel Prize for Literature in 1945. And this is talking about a child, but I think it could equally be about any burn patient. But we do know that, as I say, burns in children, the vast majority are preventable, and burns in children are really one of the biggest burdens across the globe. And as humans of whatever color, creed, belief, political value, we should put children first. So she said, "Many things we need can wait. The child cannot. Now is the time his bones are formed, his mind developed. To him we cannot say tomorrow. His name is today." And I think that's the way we should think about burn cares. Tomorrow is too late. We need to start today, and we need to carry on. Thank you very much.
Thank you very much, Tom. It's especially touching. Well, it's both you and Pragya have helped us to set the mood for next November. I think that you have done extremely well. Thank you very much. We feel very enthusiastic about what World Burns Week is going to bring for all of us. For that reason, I think it would be great to have a quick look to the program we have prepared for you. I would like to invite Lucy Kinch from Interburns. She's a part of our city committee as well. So Lucy can share with us some details about the program that what you can expect from us during World Burns Week. Lucy, welcome.
Thank you very much. It's an honor to speak to you all today. Thank you. I'd like to give you a brief overview of the week that has been organized by the steering committee in November. As we have seen, and as we all know, burns are highly complex. Much is hidden, from lack of data to psychosocial impacts on survivors and costs to health services. So the steering committee considered how best to shine a light on these issues under the overall theme, Burns, Tackling the Hidden Global Health Crisis. And what we thought was that each day during World Burns Week, we would choose a daily theme, a key message, and an image, and that every day we would have a live webinar, which will be held at 1400 GMT. And this has been organized with expert speakers from around the world, focusing each day on the daily theme. So if I can just talk you briefly through the topic. So Monday, 4th of November, the daily theme is the current state, and the key message is 20 burns a minute, more than just a number. The reason we chose this message is that up to 12 million people worldwide are burned each year, but the majority of these are from low resource settings, predominantly sub-Saharan Africa and Southeast Asia. So numbers hide a lot of reality on the ground. The webinar that day will focus on the current situation globally, and will also highlight some of the challenges. For instance, staffing, equipment, resources, and prevention measures, lack of prevention measures. On Tuesday, the theme is hidden costs, and the key message is uncovering the hidden costs of burn injuries. Costs extend far beyond the financial. They're complex and very hard to quantify. So this session will focus on the challenge of calculating the financial cost of a burn injury from a legal perspective in France, financial cost of inpatient care in Nepal, the cost of mass casualty burn incidents in Nigeria, and the psychological impacts of a burn injury from Ghana, and then the essential aspect of a survivor's perspective on the hidden costs. Wednesday, the 6th of November, shared responsibility is the theme, and the key message is united voices in burn care and burn prevention. The responsibility is shared by all of us as an international community, but also nationally, locally, and individually. So this session will focus on the linked stages of the care continuum from the survivor's perspective, the importance of the multidisciplinary team at all stages, burn prevention, which is a complex ecosystem. Thursday the 7th, shared responsibility. Sorry, Thursday the 7th, solutions. The key message is making the hidden global health crisis a public one. Reliable data is key to tackling the problem, but we very often have unreliable data with burns or no data at all. This session will exposing the problem, show how exposing the problem impacts policy decision-making and unlocks funding. It will give an example of a regional burn registry that is just being launched in Latin America, and we'll also look at an example from Australia and New Zealand. Friday, the 8th of November, commitments. The key message here is that commit and act more than words. In this session, we look to the future. We have to build on World Burns Week 2024 and make sure that this is taken forward to next year and that everybody continues focusing on the key aims. There'll be common declarations of intent and purpose to collaborate, to learn, to advocate, and take action. And statements of intent from the steering committee. Thank you very much, and please get engaged and support this first World Burns Week by organising and supporting events to raise awareness and advocate for change. Thank you.
Thank you very much, Lucy, for sharing that program with us. Obviously, this is just the launching of the World Burns Week. We are going to promote each day, each seminar, each event with the help of you all. So I think that a key message is that we are all committed for this to be a success. So we all need to be in a mindset to promote these activities, because it's the only way we can do a real impact. Just for finishing this launch event, I know that we have been a little bit late, that we have was scheduled for 1 hour, and we are already past 15 minutes. So thank you very much to all the 120 participants that have been held in onto this during your Saturday. And we know how important it is to dedicate time to family as well. This is something that is very important to all of us. So I just going to close by giving a space to Dr. David Schiffers, that will share with us some closing remarks before we finish. David, please.
Thank you, Orlando. Let's see. All right. To just share the screen. All right, so we've heard today that how burns really is a major global health crisis, and that really is marked by global disparities. And we've also heard from our fantastic speakers how how burns is not just a theoretical issue, but really is one that affects human lives. And so thank you to Pragya for saying that and showing us how it's possible to not just help survivors survive, but also thrive. We've also learned how there's many unmet needs in this world today. And so that is a wonderful, at the same time, on the flip side, it presents a wonderful opportunity for change as well. And it presents an opportunity to share resources, to learn from each other, and to create awareness and yeah, make this level the playing field a bit more. That is really at the heart of World Burns Week. And I thank you, Tom, for making this clear to us how much there is to change and how much we can really achieve together. This is also an opportunity to collaborate. And I think World Burns Week really is a testament to the fact that so many organizations have come together, sat at the same table, and rally behind this common cause. And so I think we can be proud of that. And this is a good starting point, and we should keep that, keep that momentum to go forward. This is over the last year of brainstorming, and seeing this come to reality and come to life. What has encouraged me is the unity of all the organizations that have been present in the steering committee, but also the endorsing partners that have supported us, that have spread the word. And so as we are looking forward to celebrate World Burns Week for the very first time, I'd like to invite more endorsing partners to support World Burns Week. On this slide, you can see a QR code, which brings you to an endorsement form. Endorsement is for free. So if you are a representative of an organization that is involved along the continuum of burn prevention, burn care, burn survivorship, please, and you agree with our mission, vision, please endorse us and help us make World Burns a reality by also organizing activities and events on the ground. Because really, the global program that Lucy just talked about is a program that has overarching themes, but it is far more meaningful if we can actually organize some events and activities on the ground, also on behalf of World Burns Week. So that is the role of our endorsing partners, to really echo the same message to all corners of the world. If you're an individual, I also would like to invite you to come and follow World Burns Week activities, come and attend, spread the word. As Mamta said, really make some noise about this. I think all together we can create a lot of change in unity and in solidarity. So as we build anticipation towards World Burns Week, which really is in less than, I think it's 26 days from now, I'd like to open the registration. So this is the first time that you have an opportunity to actually register for the wonderful program that we've been working for over the last year, and that Lucy has just explained quickly. Here's the QR code. We'll also paste that link into the chat, and you will see the same QR code and the same graphic come around the next few days. So if you're missing this or you're watching this later you're watching the recorded video, then please feel free to sign up then. So do join us. We'll leave this QR code up a little bit longer, and I'd like to close and say thank you to everyone. Thank you to our wonderful speakers. Thank you to the steering committee that's really made this come a reality. Let's keep the momentum. Let's look forward to next month as we celebrate World Burns Week. Thank you, everyone.
Thank you very much, David. Okay, so I think that we can close this launch event now. I will second every one of David's words. I think that we need all of us for making this a huge impact, a successful week. And I'm pretty sure that we are going to commit. I'm pretty sure that we are going to pass the word that this is happening for our cause in our world. And I would like to thank again the steering committee members that has worked very hard for preparing all this, not only for this launch event, but also for World Burns Week in 26 more days, and also to the organizations that are supporting us, all endorsing partners are a crucial part of the success of World Burns Week. So keep updated, organize your own activities, use your social media to show the world that we are going to fight very hard for making this hidden global crisis a public one. This is what we are going to do next November, and the only way we can do it is working together. So thank you very much for being here today. Thank you especially to Pragya and Tom for delivering those very, very impactful messages to our community. And we will see each other very, very soon. Thank you very much for all the attendance to this launch event. Good morning, good afternoon, good evening, good night to everyone.